This week during Mental Health Awareness Month, we'll be talking about PTSD. Post-traumatic stress disorder is a mental health condition that can develop after an individual experiences or witnesses a life-threatening, terrifying, or otherwise traumatic event, like the name suggests. PTSD can affect anyone who has been exposed to trauma and can have lifelong, lasting effects on an individual's emotional, physical, and mental health. Welcome back to our Riverside Chats. Let's get into it. Have you ever heard someone say, just move on after traumatic experience? For millions of people, it's not that simple. PTSD is more than just feeling shaken after a difficult event. It's a combination of symptoms that disrupts a person's ability to function in a day-to-day and affecting their life. These symptoms often fall under four main categories. First, intrusive memories. People with PTSD often relive the trauma through flashbacks, nightmares, or distressing memories that pop up without warning. Imagine being in the grocery store and suddenly feeling like you're back in a war zone. Or waking up in the middle of the night drenched in sweat because the past keeps haunting your dreams. Can you see how that might disrupt your day-to-day life? Second is avoidance. Many people go out of their way to avoid anything that reminds them of the trauma. Places, people, even conversations. They may also feel numb to their emotions, feel detached from others, or try not to think about the trauma at all. This often results in a disruption of their day-to-day life by trying to avoid anything that could be triggering. Third, negative changes in mood and thoughts. This might look like persistent feelings of guilt, shame, or believing that the world as they know it is no longer safe. Many struggle with memory and concentration, or they feel hopeless and disconnected, even from their loved ones. And fourth is the constant state of being on edge. People may be jumpy, irritable, have trouble sleeping, or feel like danger is around every corner, even in safe spaces. Now, given all of that, how do you know if someone has PTSD? Because not everyone who experiences trauma will develop PTSD. So what increases the risk? It could be the severity or duration of the trauma, a history of earlier trauma, lack of social support, or even genetic predisposition. Existing mental health conditions like anxiety or depression can also make someone more vulnerable to PTSD. To be diagnosed with PTSD, symptoms must last more than a month and cause serious distress or difficulty functioning. And they can't be explained by something else, like substance use or another medical condition. After hearing all of that, you might be wondering, how do people function with PTSD? Luckily, PTSD can be treated. How? The good news is, there are very effective treatments. Talk therapy, especially cognitive behavioral therapy, which helps people recognize and change the thoughts and behaviors linked to the trauma. There's exposure therapy, which helps individuals face memories and triggers in a safe environment. Then there's EMDR, a therapy that uses eye movements to process traumatic memories and reduce their emotional sting. There's a whole lot of science behind that I personally am not qualified to explain. Just know that there have been very good results with this. Medications can also help, particularly antidepressants for mood and anxiety. Some medications can even help with nightmares and sleep issues. And let's not forget the power of peer support, group therapy, and self-care strategies like mindfulness and exercise. These are all essential pieces in the healing puzzle. Now, PTSD is a fairly new term. But post-traumatic stress disorder doesn't just exist in the present. It has a deep history going as far back as ancient times, where trauma was often blamed on spirits or divine punishment. In the 19th century, terms like soldier's heart and railway spine described what we'd now call PTSD. During World War I, soldiers who broke down under the stress of battle were said to have suffered from shell shock. By World War II, it was called battle fatigue. But it wasn't until after the Vietnam War that PTSD was finally acknowledged for what it was, a real diagnosable mental health condition. In 1980, the American Psychiatric Association officially recognized PTSD in the Diagnostic and Statistical Manual of Mental Disorders. Thanks for listening. Let's keep the conversation going and keep making space for healing, empathy, and understanding. As always, stay happy and healthy. Until next time.